disease. Most people may not always think of other diseases that are actually associated with it. I worked with photojournalist Bob Rhodes to introduce you to one woman who not only has a heart condition, but she also suffers from diabetes. The connection between these two deadly diseases is the subject of this morning's Matters of the Heart.
I'm starting to feel better.
For Angela Stieg of Osceola County, she has a rather unique story. First of all, she has type 1 diabetes.
When I was 5, I got low blood sugar, hypoglycemia, and a year later, it ended up turning into type 1 diabetes.
Years later, Angela found out she had a rare form of heart disease. In fact, about 5 years ago, when she was only 31, she had a minor heart attack.
I had went into the emergency room 6 times with chest pain that I knew wasn't heartburn. And finally my family doctor ordered a heart cath. And then after he did the heart cath, he came back and he said, "I'm sorry. We did find some heart disease, coronary artery disease of the small vessels," which means the bottom vessels of the heart. They're very tiny. They're too small to stent, and they're too small to bypass. So basically, and they say it's secondary to diabetes.
This connection between diabetes and heart disease is something Dr. Jill Volbrecht, an endocrinologist with Munson Medical Center, says is fairly common.
They're actually considered to be equivalents, if that makes any sense. Diabetes is considered to be a coronary artery disease equivalent because the risk of coronary artery disease is increased so much in diabetes. We consider all patients with diabetes to actually have coronary artery disease, whether or not it's been formally diagnosed.
The question is, how do you control two deadly diseases, especially when one of them is the #1 killer?
A lot of doctor's appointments. I control them with a lot of medicine, my insulin pump. I'm off all of my medications now besides insulin.
It's important to be honest about what you are and are not doing for your diabetes. I'll have people come in here who misrepresent how high their blood sugars have been or how often they take their insulin, and I'm usually pretty good at finding that out anyway.
For Angela, she couldn't agree more. She says Dr. Volbrecht has truly opened her eyes to combating both diabetes and heart disease.
She was a breath of fresh air for me, in that she lets me tell her how I'm feeling, and she tells me what to do. Because every diabetic is different. They really are.
Now, if you are a diabetic and would like more information, there's actually an open house next month in Traverse City. Munson's Outpatient Diabetes Education Program is hosting the event in support of Diabetes Day. For all the information about the event, including the date and the time, log into our website, upnorthlive.com. And
Great job with that story.
You know, it's really interesting. You have two diseases that are just so serious. Diabetes, heart disease, and seeing how this woman is actually controlling both. It was interesting, and it gave you kind of a hopeful outlook to say that she was very positive, and you can live with both and control it.
Well, I've never mentioned this on TV, but I'm also a diabetic.
That's
and
true.
take insulin every day, and it's something that you've got to manage. You have to be able to manage it because a lot of things fluctuate. Your weight can fluctuate with it. It's one of those things. So, but good story there.
Yeah,
and she had a very good outlook.
Very good outlook, which I think is the key to a lot of things when you have that, to just be very positive.
Absolutely. Let's take a look at our forecast today. We're looking at